This is a 65-year-old female for pain in her left shoulder. Unfortunately, she was sitting on the toilet seat and somehow banged it against the wall and came here with tremendous pain. She had minimal active motion. Unable to get an MRI because she has a coil inside her brain. So this is where ultrasound comes in very handy. We did an ultrasound which shows a full thickness supraspinatus tear, but not a complete supraspinatus tear. And what's very impressive is her subdeltoid bursitis, which is quite huge and heterogeneous. So this is our patient, 65-year-old female. She kind of just banged her left shoulder into the wall while she was actually just sitting on the toilet. She kind of lost her equilibrium, I guess, for a moment. And she's very limited flexion. Just slip out. Very limited flexion and abduction. She has a positive drop arm sign. And
maybe no one put back, my shoulder came out, no? Yeah, just make some...
Made a noise?
Yeah.
We can get an x-ray again. Yeah, I'm just going to take a little, I'm just going to do a little ultrasound here of her shoulder. We can see a biceps tendon here in the bicipital groove pretty nicely. But there's just a very large overhanging subdeltoid bursa. You can see this heterogeneous mass above the biceps tendon, which is essentially an inflamed subdeltoid bursa. Pretty huge. This is all fluid. A large amount of debris in this overhanging bursa. We're going down to our pec tendon. There's the pectoralis major muscle / tendon unit. Here we are now, we're going long axis to biceps tendon. Right side of the screen is distal. Again, here's that tremendous subdeltoid bursa right over the biceps tendon with some debris in it as well, between the biceps tendon and the deltoid muscle. She really just has a really large overhanging subdeltoid bursa. I'm going to try to now look at her supraspinatus tendon. Could see some fibers, but it does look quite thin. So certainly you do see some fibers attaching on the greater tuberosity, but it does look thin. The bright signal above that, I believe, is the interface between the subdeltoid bursa and the supraspinatus tendon, so that should not be mistaken for tendon itself. And one more on the supraspinatus, looking at it in a long axis or modified, kind of crass. And here you don't see any tendon at all over the articular surface of the humeral head, consistent with a full thickness retracted tear of the supraspinatus tendon. However, as you do scroll through the tendon, there are some fibers remaining consistent with a full thickness but not complete supraspinatus tear. Here we are, we're going to look at the supraspinatus in short axis. Right side of the screen is posterior. We can see the biceps tendon and the sulcus. And now we're just trying to find the supraspinatus tendon. You really just don't see it. Again, in that zone where you would expect the supraspinatus, you just don't see it. So probably a full thickness but not complete tear of this tendon. Here we are looking again. We got the greater tuberosity, a very large fluid collection above that. Infraspinatus tendon, you can see even some fluid above that. Here the infraspinatus tendon looks preserved, but it does have some fluid above it, probably from the rotator cuff tear anterior to it. But the tendon itself looks okay. Right side of the screen is medial. You can see it inserting on the greater tuberosity. Now we're going to go ahead and look at it in short axis. Right side of the screen is towards teres minor. Teres minor and infraspinatus in short axis also appear normal. We're going to have her passively kind of go through some motions here. Subscap tendon in long axis, left side of the screen is medial. Subscap tendon looks preserved. And there you can see the subscap tendon inserting on the lesser tuberosity. Okay, now we're going to look at it in short axis, and again you can see the tendon pretty nicely. And here you can compare the thickness of the subscap tendon to the thickness of the supraspinatus tendon, and you can appreciate that it's much thicker than the supraspinatus tendon.